So there's a lot we agree on, and to say this is a welcome opportunity. I think it was wonderful to hear the President address this so early on in his administration. I think healthcare access and certainly cost has plagued all of us. So from the Planned Parenthood perspective, we are a preventative health care provider. 97% of our services to 3 million women every year are preventative health care. And so I think that focus and investing in prevention obviously reduces health care costs. And I think we've seen study after study at the state level, certainly, providing preventative health care at the outset. We estimate that for every $1 in family planning, you save $4 in other associated health care costs if you provide preventative health care in the outset. The second piece is really to echo the comments made, is we have to provide health care access for everyone. We're a safety net, community-based health care provider at 887 health centers around America. And the millions of women that come to us are primarily low income. And for many women, coming in through the family planning sector is really the way they begin to access health care. And if there isn't an affordable provider there, again, we're seeing now the impact of the economy. We see more women that are coming in who have lost their job, they've lost their hours, and so they've lost their health insurance coverage because they don't work long enough hours now to get coverage. And I was really struck by what the President said, by people who we literally see women coming in tears who are embarrassed to say they can't they can't take care of their health care needs anymore and need to come to someone who can provide health care for them, for low-income and uninsured Americans. And then I think the third area is really this question of access. I think it's not simply increasing coverage. That doesn't work if we don't also have access. And I think particularly for women's health that I think the funding that you began with, the President began certainly the stimulus with funding community health centers is an important first step, but we need a network of providers who are out there who really focus on the needs of low-income Americans, and I think particularly low-income women. So I think that question of, again, not just coverage, but also making sure that there's access is critical.